A new survey reveals most older American men plan to get screened for prostate cancer despite warnings against it. The U.S. Preventive Services Task Force recommended in 2012 men of all ages who haven't been diagnosed with prostate cancer shouldn't get the prostate-specific antigen or PSA test. Research behind it suggests the risks outweigh the benefits. Researchers used an online survey to tell 1,089 men aged 40 to 74 about the task force recommendation and asked them if they plan to follow it. None of the men had been diagnosed with prostate cancer. Here's what they found. Only 13% plan to follow the recommendation and not get a PSA test. 54% said they would still get tested, while 1/3 of men were undecided. But back to the task force recommendation. How exactly is screening for cancer more harmful? According to the task force's website, screening can often create a false positive result, meaning the test can suggest prostate cancer is present when it really isn't. This can essentially cause a patient to overreact and go through unnecessary follow-up tests and procedures, such as biopsies, which can cause fevers, infections, bleeding, internal problems, and pain. The task force says some men are even hospitalized as a result. But the logic behind this recommendation isn't sitting well with everyone. After all, treatment can help prevent death from the disease. CBS reports the American Urological Association said it was outraged and called it inappropriate and irresponsible. And Dr. Herbert Lepore told CBS there was no medical evidence to support this conclusion.
PSA has taken us down the road to decreasing the risk of prostate cancer death. We all recognize we got a long way to go to perfect screening, but the last thing we need to do is turn back.
The task force says the best approach is to let patients make an informed decision after talking to their doctor. For Newsy, I'm Logan Tittle.